I am happy on behalf of the Regional Health Directorates and the Central Regional Health Service to welcome all of you to the Central Regional Health Sector 2019 Performance Review Meeting. For the next 3 days, we shall review the health activities carried out in the region during the year just gone by, that is 2019. About 2 months ago, I assumed the leadership of the Regional Health Service to continue with the mandate of Ghana Health Service in terms of our resolve to fight epidemics and improve the health status of the people in Central Region. Upon assumption of office, I made effort to visit many of our collaborators and partners who have been working with us to establish the rapport at that level and to forge a closer partnership for our mutual benefits. I am still on those familiarization visits and would in due course visit all of you. Let me, however, take advantage of today's event to welcome all of you, especially those that I'm here to officially visit and will be meeting them here for the first time. The health sector and Ghana Health Service, for that matter, Nana Chairman, remains one of the few, if not the only government sector or agencies that every year continually opens up its performance for critical review, evaluation, and assessment by stakeholders and partners. The annual health sector performance review meetings have become entrenched on our health calendar and forms an integral part of our program of work for each year. We are happy to open up our performance for this critical review, evaluation, and assessment by ourselves, stakeholders, and partners, because of our understanding that the achievement of the desired health outcomes requires team approach and the active collaboration and partnership of key stakeholders and other agencies. Our regional annual health sector performance review meetings therefore offers us a unique opportunity and a platform to discuss the performance of the health sector indicators in the region in general, identify performance gaps, and develop consensus on priority issues that need to be addressed to improve performance and the health status of the people we serve. Nana Chairman, the theme for this year's annual performance review is Achieving Universal Health Coverage Through Excellence in Health Service Delivery. This year's theme has become carefully chosen to reflect our collective approach and the regional strategy towards the achievement of the universal health coverage. In recent decades, the universal health coverage has emerged as a key strategy by World Health Organization and other member countries for making progress towards other health-related and broader national development goals. There is global consensus on the goals of universal health coverage, which has been defined that all people receiving quality health services that meet their needs without exposing them to financial hardship in paying for them. Nana Chairman, if you are able to fully implement the universal health coverage, then we stand a good chance of improving the lives of the citizenry substantially and thereby health indicators of the populace, as outlined by the UN Sustainable Development Goals. That is why I'm happy to inform you, Nana Chairman, that we in the Central Region, under my leadership, have adopted a regional vision and strategy for improving the lives of the people by working systematically to improve the health outcomes for the general populace and persons seeking health services in our facilities. Our regional vision and strategy for achieving the universal health coverage is under the theme, Improving Performance and Health Outcomes through Excellence in Health Service Delivery. The theme for our review is therefore closely related to our strategy for health delivery and reinforces the principle that should guide managers and service providers at all levels of our service. Nana Chairman, invited guests, ladies and gentlemen, if we seek to achieve excellence in service delivery, we must work assiduously to bridge performance gaps in 5 critical areas I chose to call the pillars or the building blocks of excellence. First and foremost, we must seek the safety of our clients by designing and delivering healthcare services that guarantees utmost safety to the patients. We must also endeavor to provide them with quality health services that improve their health outcomes. We must also improve our capacity and skills to effectively engage the people and the communities we work with regarding the health services we seek to provide to them. The financial security of our facilities and clients should also concern us as a service. If we focus on service delivery without taking steps to ensure we recover the cost of the services to sustain our institutions, we will not be in a position to sustain the provision of these services. Similarly, we should be concerned that our clients, especially the poor and vulnerable in society, have sufficient financial risk protection through insurance and other social protection safety nets to be able to access our services. The other pillars of excellence relate to our obligation to grow as a service by continuously innovating and adding new services. The health worker must also view the job as a call to service and provide services to the clients with love and empathy. Nana Chairman, as part of our activities lineup for today's ceremony, a team from Northern Region who had earlier assessed us in terms of our performance on the holistic assessment indicators will present their report. Without attempting to preempt what the team will say, I am happy to note that the Central Region has made tremendous progress in the achievement of the holistic indicators, and thereby moving the Central Region from a moderately performing region to a high-performing one. Let me congratulate all my staff, especially the district directors and the medical superintendents and directors, who have worked very hard for these collective achievements. We must continue to work hard in the years ahead and endeavor to document our collective progress appropriately on the nationally networked database, the DIMS2 platform. Nana Chairman, permit me at this juncture to highlight some notable achievements and progress that has been made. In terms of infrastructure, I'm happy to indicate that the regional health services continue to increase access to health services by scaling up the implementation of CHIPS concepts and making more CHIPS zones functional. Through the kind collaboration with our various metropolitan, municipal, and district assemblies, a number of CHIPS compounds were also built and operationalized during the year to bring the regional CHIPS implementation close to 70%. Even though transportation in general continues to be a challenge, with many of our districts and facilities not having sufficient vehicles to facilitate service delivery. But I must say that in 2019 and early this year, modest progress has been made with providing our facilities with the necessary transport logistics. In all, 12 brand new pickups vehicles were delivered to some of our districts. We look forward to complete the program to provide each district with a functional brand new vehicle for service delivery. During the year under review, most of our maternal health and child health performance indicators were very positive, reflecting results from our continuing effort at improving the health status and conditions of women and children in the region. For example, the family planning acceptance rate increased from 32.6% to 35.3% in 2019, while the proportion of deliveries attended by trained health workers stagnated around 65% in 2018 and 2019. The proportion of mothers who made at least 4 antenatal care visits increased from 76.9% in 2018 to 81.6% in 2019. Nana Chairman, I must indicate that the incidence of maternal deaths in our facilities is one of the critical health care issues we must all collectively work to address, as the numbers of our mothers who die from childbirth is still high across the region. I must, however, also add that for 2019, the incidence saw marked decline, which gives us hope that when we all put our shoulders to the wheel, we can collectively reduce the maternal mortality burden in our communities to the barest minimum. The indicative institutional maternal mortality ratio per 100,000 live births declined from 126 in 2018 to 105 in 2019. Another area that we need to double our efforts, Nana Chairman, is in our EPI coverage, as immunization confers protection on our children and prevent diseases such as poliomyelitis and measles in children. The regional EPI indicators saw some marked improvement, as Penta-3 coverage, for instance, rose from 91.9% in 2018 to 94.9% in 2019. And measles rubella 2 coverage improved from 78% in 2018 to 81.4% in 2019. Nana Chairman, let me draw attention to some few challenges that continue to hinder our collective progress towards the achievement of our desired health outcomes. The first and most important of these challenges has been the unavailability of the required numbers of essential health staff to provide the basic services to the populace. While there are shortfalls across all professional categories across the region, the situation regarding medical doctors is a bit worrying, as many newly qualified doctors continue to refuse postings to the region. I must acknowledge, however, that the situation with the doctors improved slightly in 2019. All stakeholders must join us to completely tackle once and for all the root causes of health workers not willing to accept postings to our region. On our part, we have proposed some incentive packages for implementation by district health directorates with support from the district assemblies. We have had preliminary discussions with the Honorable Central Regional Minister on these proposals, and he has given us his blessings and assurance of his maximum cooperation in this regard. We will in due course roll them out with the hope that the implementation of these incentive packages will go a long way to attract qualified high caliber technical staff to the region. Nana Chairman, another area that we need to double our effort is in our EPI services. The nation is experiencing measles and polio outbreaks, and we in Central Region need to double our efforts to prevent such outbreaks by intensifying our immunization services and creating demand for these services through community education on immunization services. Currently, Nana Chairman, the country is faced with a triple burden of diseases, namely communicable diseases, non-communicable diseases, and road traffic accidents. Non-communicable diseases such as hypertension, diabetes, and cancers can be minimized by adopting healthy lifestyles such as regular exercise, healthy eating habits, and regular medical screening to identify these conditions early enough for prompt medical treatment. Intensive education and sensitization on healthy lifestyle is ongoing in all facilities and districts. And all hospitals have been encouraged to institute wellness clinics where normal healthy people can walk into for screening of health conditions such as hypertension, diabetes, and receive counseling on healthy lifestyles. The issue of road traffic accidents and its resultant injuries and deaths are of serious concern, and we are working with all stakeholders to address this issue, as well as provide prompt and quality health services to those who fall victim to these situations. Nana Chairman, as I indicated earlier, if we continue to focus on quality health services without paying attention to cost recovery and the financial sustainability of our facilities, we stand the risk of running these facilities down and not being able to sustain the delivery of the quality health services and the positive health outcomes we all desire. It is against this background that we wish to formally draw the attention of the government and other relevant stakeholders about the unduly long delay in reimbursement of national health insurance claims to our facilities. If we are truly to eliminate finance as a barrier to the achievement of universal health coverage, then the National Health Insurance Authority must ensure that facilities are reimbursed timely to enable them procure the medicines and other logistics needed to provide quality essential services to the people. Before I take my seat, Nana Chairman, let me acknowledge the contribution of various persons and institutions that have contributed immensely to our achievements and progress as a health service in 2019. Let me first and foremost express our gratitude to the government of Ghana as represented by the Ministry of Health and Ghana Health Service. The Ministry of Health and Ghana Health Service continues to recruit the needed health workers for the region. In 2019, the region received its fair share of the various categories of staff that were given clearance for formal engagement by the service. As we continue to request for more of these staff, especially the staff in the utility and support category, We also wish to plead with the Ministry of Health in particular to support the region to obtain financial clearance to employ the large number of IGF-dependent staff who have worked with the service for a considerable length of time now and have acquired the relevant work experience. Let me also express our deepest appreciation and gratitude to the various health partners without whose continuing support we would not have made much progress in achieving many of our health indicators in 2019. Special mention must be made of the USA Systems for Health, who have acted as our main backbone for the past 5 years. They rolled out many strategic intervention programs that have resulted in the improvement of the quality of life of our people, especially women and children. We also appreciate the partnership of the PSM, which supported the region to successfully roll out the last mile distribution program that has made health logistics and supplies readily available for service delivery in the hard-to-reach rural communities. Our partners such as ANISVAD, Millennium Promise, IPAS, and the Vision for a Nation are all making critical interventions in our health delivery systems to improve the health status and quality of life of our people. We are also grateful and appreciative of the collaborative efforts and support of other agencies and departments such as the Regional Coordinating Council, the Ghana Education Service, the Regional Police Command, the University of Cape Coast, especially the University Hospital and the College of Health Sciences, the Ghana Prison Service, our health training institutions, the Ankafo Psychiatric Hospital, the Cape Coast Teaching Hospital, and other decentralized agencies I cannot mention here for want of time. We are grateful to all of you. As we review, discuss, and evaluate our performance in key service delivery indicators for 2019, it is our hope that we will be able to holistically adduce reasons for the gaps in our performance and collectively prioritize key interventions that we need to make as a health service or as partners in health to address these challenges. We are grateful for your time and the efforts you have made to participate in our 2019 performance review meeting. May the good Lord richly bless all of us. Thank you.
Dr. Patrick Kuma Abwaje to deliver this message on his behalf. He would have loved to be here, but circumstances beyond his control could not enable him join us. You are all aware of the coronavirus in the system, and it has kept them on their toes. Meetings and meetings and meetings. So he said I should apologize on his behalf that he can't join us. Internally generated fund management and National Health Insurance Authority co-payment issues. Poor emergency response systems, data quality, completeness and utilization issues. Running vertical or program-based services at all levels, low functioning facilities in the primary level, setting up of 6 new regions, non-communicable diseases and the triple burden of malnutrition. Some of the recommendations and suggestions made to address the challenges that will be pursued in the coming years are: 1. Promote efforts and innovative actions to ensure the public or communities maximize the use of health facilities to generate more revenue. Engage National Service Secretariat and NAPCO for personnel in order to reduce the number of casual staff, as well as the wage bills footed by the regional medical stores and hospitals. Rationalize the use of IGF and identify innovative and mitigating effects of delayed payments from health insurance. 4. Improve capacity of all key managers in DIMS and ensure mandatory scheduling of the data review activities by regional directors for all districts and BMCs. Ensure that the processes of peer review, supportive supervision, and holistic assessment remain the key to drive quality and are linked to outcomes. 6. Ensure fair distribution of critical staff across all regions through the creation of incentive package for officers. who are posted to deprived areas or establish a rotational system for postings to deprived areas. And I must mention that for the GHS or Ghana Health Service, we have completed the deprived area incentive package and will be disseminating it soon. It may not be monetary or financial, but there will be conditions for you to attract people to the deprived areas. 7, involve the senior staff in the hospitals in the work of the regional health administrations and district health administration, especially on clinical care issues. 8, involve training institutions in the capacity building activities of the regions. 9, explore innovative and cost-effective ways of training managers on the DSHOP model. I must say this DSHOP model was piloted in the Upper East region, and since then they've been calling for us to come back. Unfortunately, we have no funding to continue, and then we are going to explore other ways of cheaper ways of delivering this model to improve management at those levels. Nana Chairman, moving forward, the issues of integration and accountability for stronger health systems performance and improved health outcomes is important. Discussions and implementation reforms should shift service delivery away from fragmented programs to provider-centered models of care to ensure that there's increased access to a continuum of care. The current health delivery system must be responsive, coordinated, and in line with clients' needs along the life course and to achieve the UHC targets as we all endeavor to creatively find workable solutions that can improve access to cost-effective quality health care for our women and children and the general populace. The call is for each and every one of us in whatever capacity we serve to be part of a service that is positioned to ensuring that everyone in their respective regions, districts, and communities can access a package of essential health services and work toward universal health coverage that translates to mean fewer mothers die in childbirth and more babies are born healthy and improved livelihoods for all. Lastly, Nana Chairman, I will want to brief you on the country's preparedness to tackle the novel coronavirus, popularly called COVID-19. As a service, we are working with the Ministry of Health and partners to prevent and protect against the importation of the virus into the country and prevent the spread. We have put in place comprehensive systems to prevent and handle cases should there be any in the country. Key amongst these strategies include training of port health staff to screen passengers at the entry point, especially Kotoka International Airport. Training of teams at Tema and rich hospitals to handle suspected COVID-19 patients. In addition, alerts have been sent to all regional directors of health services, and we have activated rapid response teams. Some training have been conducted for these teams, and some isolation centers have been identified. There has been a revision of the National Influenza Pandemic Preparedness Plan with support from the WHO Country Office. Procurement of 10,000 personal protective equipment by Ministry of Health and Ghana Health Service is expected. And I must announce that yesterday, some of them were delivered to the Public Health Division. Currently, 5,000 already delivered and some distributed. Thematic groups and national technical coordinating committees have been activated. These include planning and coordination, surveillance, laboratory, case management, and risk communication. It is worth stating that the country has not recorded any case of the virus, as the 9 suspected cases reported as at the 25th of January 2020 turned out to be negative. And the recent one in somewhere in Ashanti who came and died was also tested negative, even though there are rumors that it was a virus. No. We will continue to monitor the situation at our ports of entry and provide responses through health promotion, surveillance, and intelligence. Nana Chairman, on behalf of the service, DG wishes to thank every staff of the Ghana Health Service, especially those working in the central region and extremely trying circumstances. I am optimistic that together we can improve our lot as health workers as we work together to improve the health of our population. I wish you a blessed and prosperous new year and a new decade. Thank you.
Not only in Central Region, but also throughout the country. In this region, there are several development partners working here. I do not want to mention names. I am a part of the consortium implementing the R3M, which is the reducing maternal mortality and morbidity. This is a program that has been in this country for 13 years. Started in Ashanti region, Eastern region, and then we came to Central and Western. It's indeed a privilege to work in this region. We've been here over the past few years. I'm glad that this meeting goes on every year. It's very unusual for a government ministry to do this, and I congratulate the Ghana Health Service for doing it. Indeed, if all other ministries were to do this and departments, I think we'll learn from our, won't say shortcomings, but our indicators and improve upon them. But I just also want to mention that, as the regional director mentioned, our indicators are improving as a region. And as we improve in this region and in all other regions, our indicators at the national level also improves. And as that continues to happen, and we are glad that it's doing so, there are unintended consequences. And that is what I want to draw attention to. And the unintended consequences are good or bad, depending on how you view it. As we keep on improving our indicators, donors begin to view us as a country strong enough to stand on its own. And I think that's a good achievement. But the downside is that some of the resources which used to come to the country will no longer come to us. And I think it's a good thing. So that is what I'm talking about. As our indicators improve, donor grants reduce. So Ghana, we are now in a stage, as a university professor I used to be, I would say we are now a graduating country. We are graduating gradually from donor funds. And we must be prepared for that as healthcare providers. So some of the organizations that used to work in the regions may no longer be doing so, because the donors have said that Ghana, you are grown, you've achieved a lot. You have your national health insurance, your indicators are improving, your economy is improving, your democracy is among the best in Africa, and therefore goodbye Ghana. And I think we have to be ready for that. I'm saying this because that should not be a reason for our indicators to continue to start to reduce. We have to keep on improving. And as we do that, all the other countries will know that, yes, with or without donor funds, Ghana is able to improve on its health indicators. As somebody who has worked both in the government sector and now in the private sector, I know how hardworking many of us here are. But as we begin to meet the challenges of donor fund dwindling, I have to encourage all of us, even to work harder, so that we not only sustain what we have achieved, but more importantly, improve upon it. On this note, I want to wish this review meeting, a very successful meeting. And I hope and pray that as I visited last year, and I've been invited again this year, next year, I'll be invited, or I'll invite myself to be. Thank you very much.
And all of you, wonderful members of management, right from national through region to the district, in the various strands of professionals in the service, and also stakeholders in the service. Now, friends from the media, ladies and gentlemen, once again, good morning. This is my fourth time of being part of this review meeting. In fact, it is quite one that I easily recall. Upon assumption of office, my first public engagement was attending the 2017 review meeting. And since that meeting, every single year, I have been part of the meeting. I've always had admiration for the Ghana Health Service on this effort. Whether they have the resources to do it or not, they do it. I'm sure because they tell themselves that we can't afford to let go a year where we will not meet to look at our targets, performance, and to be able to set goals and work towards them in the future. So even if they are staffed on all fronts of resources, they commit to doing it. And that for me is highly commendable. And I'll continue to urge the service to continue this way, where you take a critical look at how you have performed and where you are falling short and where your strengths are, and even more importantly, that other districts will learn from what others are doing. Sometimes improvisation, all of it intended to deliver service to our people. Today, I want to commend the regional director, Akosia. It's because if you never knew, you will say she's an old wine. Already she's tasting good. Instances are where heads are posted to a new place. They just come and take a look, and then they go back, trying to put themselves together. Sometimes it takes 2 weeks, sometimes a month. And when they come, oh, a few things I've left behind, I need to go back. As soon as this director was posted to this place, she came like a soldier marching. And since she has not looked back, and I commend you. You signed yourself for this posting, and you have lived up to the billing. In much the same way, I want to commend all of you directors, district directors, from the last review and now. You have heard the thoughts. I, as a minister, I get briefing every day on all sectors. And the briefs that I've had between the last review and now, you have done quite well. I first want to take a look at the theme itself. That your theme is not accidental. Achieving universal health coverage through excellence in health delivery service. My understanding of Universal health coverage is this that the people must have access, that it must be promotive, that it must be preventive, that it must be palliative, that it must be creative, and all others that you can add on. That there must not be barriers, even financial. It therefore doesn't come as a surprise that for the last 3 years or so, consistently preceding you, Akosia, and your good self, and all of you at the district level haven't worked so hard to elevate the status of the region from a moderately performing, as I saw it, 3.7 out of 5. Now you have gone up to 4.3 out of 5. What it means is that you are living to the billing of universal health coverage. But the tendency is this, that once we climb to the top of the mountain, sometimes complacency, maybe not deliberate, begins to set in. Oh, after all, I'm on top of the mountain. There's a saying that when you get to the top of the mountain, that is when real climbing begins. It will not be a good news that if we met here next year, and we will, because as I know, you don't compromise on your meeting at all. So next year, we'll meet. But it will not be a good news, piece of good news, that if we came next year and that there's a dip, the other man will say, Tafiakwa, that it passes. So you must commit to doing more. That having moved from 3.7 to 4.3, let's get the news next year when we meet here, that now we are hovering around 4.8. Director, is that not possible? Because I can hear you giggle. Maybe the marking scheme can't take you there. You can go there once it is out of 5. What that means is this, that as the district director, you must be innovative. The challenges are there. And who tells you that the president himself, who indeed has a mandate to manage resources for on our behalf, doesn't have challenges? He does. Every stage, everywhere, the challenges are there. But it was not a mistake that you found yourself there as the district director. It's because you have the capacity to be there. That is why you are there. And that is when you have to bring your leadership to bear, your innovativeness, thinking outside the box that yes, the challenges are there, but I will still overcome these difficulties that confront us. That is what will make you an outstanding district director. And the region is nothing but aggregation of the districts. It is when the districts are doing well, that is what reflects on us as a region. And by extension, the regions are doing well, then it means the country is doing well. So, in my view, if you look at the chain, the most critical is the district level. As for the data at the regional level, only superintending and coordinating. But the real action is at the district level. I have no doubt at all of you that haven't come this far, brought health delivery in the region this far, that you even commit yourself to doing more in the years ahead of us. Let me now, even though the Director Human Resource has given us some hints on what the service is doing in the area of this dreaded coronavirus. But, Madam, I have taken a look at some of the thematic areas that the service itself has put out, including coordination, entry points, surveillance, case management, infection prevention and control, risk communication, You are also talking about social mobilization, logistic mobilization, partner support, all these are thematic areas. But my emphasis must be on the social. If you're talking about social mobilization, my view is that you want to get the populace along. Unfortunately, sometimes when I tune my radio, you have anchors, you have radio personnel, you have journalists who virtually, the effort that the service is putting in, the ministry is putting in, as though nothing is happening at all. And in my view, I would not take it against them. It's because probably they themselves also want to see and hear something. Go on. They want to agitate minds so that all of us can converge on the things that we need to do. But they go to some extreme, as though that Ghana, we are only waiting and sitting down until we are struck. But I know that if for nothing at all, at the level just as you said, your Director General has never had rest, and the very people at the very top have consistently. And just last week, the regional director herself, plus the CEO of the teaching hospital, they had been to a meeting in Accra, and I was told that they have been having such meetings, all of it preparing and putting our country in a position of readiness. That we pray it never comes, but in the event that it does, that we're ready to meet it head on. So, journalists who are here, media who are here, it's important also that if we are not seeing, you can't sit in your studio and see. Take the necessary steps and get to the appropriate offices. But the point I want to make here is that if at the district level, the district director will have some space to either in the communities or go to the radio and prepare their minds, educate them the do's and the don'ts. And if they ever had any suspicions, the things they need to do, if we begin to talk more, me as politician, if I speak, it will just pierce here and goes here. There's a politician talking. And you are a professional and you are speaking, everybody will pay attention and listen to you. So that thematic area, which is social mobilization, which in my layman's understanding, getting the populace to be along, we must, as professionals, as those who are at the district level, we must begin to speak, to put hearts at ease, and to make our people know that the service is doing all within its power to ensure that if it ever came, we are ready to meet it squarely. The last then, I would hold the leg of the chair. That as minister, it's a whole schedule. And I would have wished to sit in. My first part of the meeting, I had the opportunity to sit through to see how the districts were doing. Unfortunately, the subsequent years, the load had grown bigger and bigger. And once I was done with this, I leave. So this time also, when I'm done with this, I leave. So Dasibra, forgive me. It's all my wish that I see actually what is happening at the district level. But that notwithstanding, the regional director will fill me in. The last bit is that you haven't come this far. The challenges are still there. And some of the things that you reiterated, that postings of professionals to the region, ways by which we could put up some incentive packages to assist. I think that primarily and fundamentally, it is our duty as professionals to accept postings. That one is our obligation to be there. But human as we are, there might be some other factors. That is why Director Human Resource herself, the service itself, is working on some incentive packages for you. We as a region also, in the next 2 weeks or so, will have the coordinating council meeting and we'll give you space. And when you have this space, please hammer more on this. And then I will take it from there, engage with all the district chief executives, that it's important. If you have a doctor in your district, if you have the midwives, if you have the nurses in your district, what that means is that you have invested in the wealth of your people. So as chief executive, you have your peace of mind. So the next 2 weeks, you have the space to hammer on that. In the area of Chase Compound, if you look at their annual budget, development budget, A portion is supposed to go into health facilities. And it's become like a certain challenge amongst the districts. I'm going to hammer more. That now we have by your rating 71.4% or so, and that we could do better. And that all depends on the effort that the districts put in. I'm going to admonish them to commit more in building the chief's compound. It is in doing that that will give life to the theme, universal health coverage. On this auspicious note, I wish this meeting a big success, and I know that the deliberations will be far-reaching, and that all of us will learn from the strength of others, and in the coming year, we'll be able to improve on our weaknesses. I thank you for your kind attention.